Hello. Today I'd like to take you with me on a small portion of knowledge that we developed for the upskill program. We gave some classes both in the first and the second trainer school that we developed on the development of cases and the use of case-based learning. I developed these lectures and gave these lectures together with my colleague Salma May. But I'll be giving this short presentation for you today. The idea behind these practice-based classes was mostly to also exercise practice with developing cases, using them for case-based learning classes and guiding the students how to perform clinical reasoning based on real-life cases. And I'd like to take you through the steps of how to do that, but this won't be a very extensive class that you can follow in full. So hopefully it'll give you some inspiration as a teacher or as a clinician wanting to discuss cases with colleagues. So what will we be talking about? We'll be talking about writing a case. What kind of case do you need for a case-based learning class? How do you use a case in clinical reasoning, and how do you practice and develop skills in guiding a clinical reasoning process? And we divided this up in 4 steps. Step 1, thinking of an initial hypothesis and doing an anamnesis, a patient interview. Step 2, getting to the hypothesis and a testing plan to really test those hypotheses. And the testing itself. Step 3, the hypothesis to treat. So how do you formulate a treatment plan based on the hypothesis that you found to be present? And then step 4, performing the treatment. So performing the intervention, but also making an evaluation plan and evaluating the treatment plan. And I'll give you some examples of those different steps and how you can put them into your case-based learning classes. In step 1, what is noticeable that we don't give out a full case. It can be very short, like a 1-line referral letter from a doctor, like you see on the screen. And what this does, this will should raise questions with the students. And what you'd like to do is activate the initial hypothesis. Okay, you've got 1 line of information. What do you first think of? Do you understand the information that is given, and which information do you regard as crucial? So based on a very short amount of information. It can be a little bit more than just a referral letter, but keep it short. And then the next question would be to think about the additional information that you want to get. Are there possible red flags? How would you ask for those? Why do you think a certain amount is relevant? If you ask for additional information, why do you want to know it? And how do you think you should ask it? And those are things that in a class as a teacher, you could also challenge the students with. Okay, so I present you a little bit of information on this patient. What do you want to know? And then when they tell you what they want to know, the next question could first be, why do you think it's relevant? Why do you want to know it? Because usually there's a hypothesis behind that, and that teaches students to really think of okay, this is the hypothesis and this is a relevant way of asking it. And maybe the connection between the questions that they want to ask and the hypothesis that they say is behind it is not so relevant, and then you can discuss that as well. And a practical application would be to practice a patient interview, to really exercise how should I ask those questions, and how should I could I gather the information. And the student need to be able to gather all the information they need to be able to get to step 2. An example of step 2, the case that you would give in a class would be more information. So you would give out all, or at least most of the information resulting from step 1, so the subjective assessment, the information from the patient interview. And what you see on the screen is not complete, and it's just one example. It's a case that we used in the classes that was a patient of a colleague of ours, of Allard Bakker, so thanks to him for letting us use this. And what you would do with that information would challenge the student to analyze this data using the ICF, so dividing it up into functioning, activities, participation, internal factors, external factors, and then formulate the hypothesis based on this amount of information. And then can follow a discussion on these hypotheses and how to assess this. How do I, if I have an idea of what is wrong with this patient or what is a problem, how do I confirm that with a more objective examination? And in this phase also, it's very important to realize, like, from that subjective assessment, are there factors that warrant a referral of the patient? And if you have discussed the hypothesis, you know how you want to assess these, then you can formulate a plan for your objective assessment. And very important thing to discuss is, are the tests that you have chosen to put into your assessment plan, are they consistent with hypothesis that you formulated? Well, of course, practicing this could be practicing the assessment plan, and then also seeing, like, can we narrow down from the maybe broader amount of hypotheses that we had to the clear hypotheses that are relevant for this patient. When we get to step 3, as a teacher, we would go into this step, into this class, with more information. So on top of the subjective assessment, so the information from the patient interview, we'll add all the information done on the physical assessment. So we'll further along in the clinical reasoning process. And again, this is an example from the same case that I showed you before. Not complete, and this can be more, this can be less. If it's less and patients feel like they miss something, we can go to step 1 and step 2, like, okay, why do you want to put it in? What is your hypothesis? Is the test that you're suggesting fitting with the hypothesis that you have? And in this step 3, again, analyze the data using the ICF. So you have more data, you have the more objective data that you gathered as a physio, so you can more fill in your rehabilitation problem solving form or the ICF module more completely. And then you try to get to a conclusion as a therapeutic diagnosis, and things that you can put in are also the factors that are relevant as prognostic factors for recovery. But also very important to ask yourself, are they modifiable by physiotherapeutic intervention? Is the patient in the right place when they come to you as a physiotherapist? And then on this information you formulate a treatment plan. So some of the hypotheses will be left over from narrowing down that you did in phase 2. And then you formulate a treatment plan in which the goals of the patient and the activities that they want to do, what they want to participate in, the functions that are basic to be able to do that, should all be put in the treatment plan. But you should also think about frequency, the duration, the time of the entire process, and evaluation. And a practical application that we could do in the class is also practice discussing this treatment plan with the patient using shared decision making. Patient expectations are something that you should have already get an idea from, but then reporting back to the patient, okay, I've heard this, I've done this in this test, I've seen you move like this, and putting it all together, I think the most important thing that we should work on should be this, and this is my way. I think we should work on it. But the patient has ideas about them themselves, and you want to have a shared idea of the treatment plan and the process that you're entering into together. From there, the next step would be the treatment progression itself. So practicing the intervention and following up the intervention. And in step 4, as a tutor, you can get into the class with, okay, this was my plan, and this is what happened in the treatment progression, in the appointments that we had. And then from there, you can practice treatment situations, of course, but they should include evaluation and evaluative tests. Are we still on track with what we thought would be a normal process of going through this treatment plan, this treatment progression? The students can give each other feedback, or you as a tutor can give feedback on the content of the intervention, but also on the communication skills. And you can reflect together on the interaction with the patient. The therapeutic alliance is a very important aspect of treatment success, especially when it comes to pain and chronic pain. So giving feedback on communication skills as well as on the intervention itself, and reflecting on the interaction with the patient, very important things to do. Then evaluating the treatment progression. So discuss the relevance of the evaluative measures that are chosen, and also what is the impact of the outcomes on the treatment. So you test something, you have a result from a certain test or a measure that you do. Does it fit with your expectation? Does it fit with where you are in the treatment process? Or should you amend things? Or should you conclude like, okay, maybe we've reached what we want to reach, or what is possible to reach, or maybe the treatment doesn't have the expected effect, we should do something else, or maybe we should refer back to the general practitioner or the medical doctor. So these are important decisions. And then from there also the question, determine an endpoint for the therapeutic process. Are the goals reached, or are the goals re-evaluated, or is there no progression anymore? And a practical thing to do is also discussing this with the patient. The patient could have very different expectations to what should be done. So discussing the endpoint of the therapeutic patient and rounding up the therapeutic process is a very important thing to practice with students. So I've divided now the case-based learning approach into 4 different steps. I've shown you the amount of information that as a teacher you take with you into the class, and how you challenge the students to think, to get into clinical reasoning, but also to exercise certain steps of the process. Hopefully this will help you in some way, and I'd like to end with saying good luck with your next case-based learning class and developing those. Thank you for your attention.